The updated safety label. The updated safety label for the mRNA COVID vaccines harmonizes the age range across products and adds additional data about the adverse event of myocarditis and what we know. It's based on two factors. It's based first on the unadjusted crude incident rate from the 2023 to 2024 formulation, and it's also based on persistent and concerning cardiac MR findings. So this is a slide that we put together. This is the FDA analysis of the BEST system, which is an observational data system that captures myocarditis and pericarditis following immediately afterwards, the first 7 days, COVID-19 mRNA vaccination. And what you see here is that even in 2023, 2024, the last year for which we have data, you see a rate of myo and pericarditis of 8 out of 1 million in all persons in this age range. And in the highest risk demographic group, young men between the ages of 12 and 24, it's about 27 per million. Notably, the BEST data set does not allow us to disambiguate the risk by product, and as such, this is a class mRNA safety label. The second piece of evidence that is captured in the new safety label update is some concerning findings we've noted with late gadolinium enhancement. Now, late gadolinium enhancement is a radiographic abnormality seen on cardiac resonance imaging, and this is how it's been described prior to, in the literature, in the context of myocarditis. Patchy myocardial and focal subepicardial enhancement as an expression of potentially irreversible injury is how it's been described. The FDA notably funded a study led by Jane and colleagues in 2024, which showed among hospitalized patients with COVID-19 induced myocarditis, a high proportion, the majority, had initial late gadolinium enhancement on cardiac MR. But most concerningly, at 5 months of follow-up, 60% of these patients continued to have LGE. And our results for late gadolinium enhancement are consistent with many, many others, as I'll show you here. This was a study from Australia that followed post 6 months for post-COVID-19 vaccine-induced myocarditis. Over half of the patients were still reporting symptoms. 67% had abnormal follow-up cardiac MRs, and 35% showed what was listed as evidence of fibrosis. I did a quick systematic review pulling all available publications documenting late gadolinium enhancement, and these are some takeaway summaries. 92% is occurring in men, 90% have LGE at presentation, but most concerning, 72% have persistent LGE even months thereafter, very consistent with the FDA-sponsored study. Late gadolinium enhancement is not a benign clinical finding. Multiple studies document that LGE is a poor prognostic factor. That's in many cardiac settings, including for patients with myocarditis. LGE has been associated with increased future cardiovascular events and even increased mortality. We do not know the precise implications for LGE from vaccine-induced myocarditis, in part because the follow-up is necessarily so limited. For this reason, the US FDA and the sponsors have issued an SLC with the following two main points. One, the updated unadjusted incidence of myocarditis and or pericarditis was approximately 27 per million, or 1 in 37,000, in males 12 to 24 years of age for the 2023 to 2024 formulation. And two, at a median follow-up of approximately 5 months post-vaccination, persistence of abnormal cardiac magnetic resonance imaging findings that are a marker for myocardial injury was common.